Some of the principles of myeloma treatment, the goal of treatment is actually control of myeloma, not cure of myeloma, because we believe cure is not something that we have can reliably achieve for this cancer in a vast majority of our patients. We like to do 4 drugs for treatment at the onset of treatment. We like to do transplant early on for these patients as well and keep them on maintenance for the foreseeable future. When I see any patients with new myeloma, the very first thing I do is I determine whether that patient is transplant eligible or not. And secondly, whether they have high risk or a standard risk myeloma based on the mutation testing on bone marrow. So it's very important to get those testing done with your physician to know what kind of myeloma we are dealing with. This is a treatment algorithm that we follow at our site at MSK, that every new myeloma patient at the time of diagnosis gets stratified into transplant eligible or ineligible, standard risk myeloma or high risk myeloma based on the bone marrow mutations. If you happen to a standard risk myeloma, we choose to give 4 drugs because of all the recent evidence we have seen with that regarding the effectiveness of 4 drugs. And if you happen to have a high-risk myeloma, we'll replace the bortezomib chemotherapy with carfilzomib. We usually give 4 months of chemo. That's the first stage. Then we go on and collect the stem cells and take patients to bone marrow transplant. The transplant process takes about a month, but we do give a break of about 2 months after it's completed. And then after this transplant is completed, we move the patients to the third stage of maintenance chemotherapy, which patients continue until myeloma comes back again. If you happen to be a transplant ineligible myeloma, we again stratify you as a high risk or a standard risk myeloma. Standard risk myeloma tends to do very well with 3 drugs alone. With high risk myeloma, we choose to give 4 drugs for about 6 to 9 months. And if you see a very good, very deep remission, we again move you on to 3-drug maintenance chemotherapy. We continue this chemotherapy as long as myeloma remains in remission and you tolerate chemotherapy well.